Welcome to this explainer. Today we're diving into something that happens completely behind the scenes, yet it affects pretty much all of us. I'm talking about the massive, and I mean massive, responsibility of storing sensitive patient data. Healthcare organizations have the daily task of safeguarding vast amounts of highly personal information. For the longest time, keeping all this data locked up on local, in-house servers was just the default. But moving from those clunky local servers to cloud storage specifically built for HIPAA compliance, it's honestly no longer just a nice-to-have luxury. It is absolutely essential for everyone, from a tiny local clinic to a massive hospital network. The U.S. Department of Health and Human Services has made it incredibly clear that strict safeguards are mandatory. So let's jump right into these 5 ultimate advantages. And as we go, you'll see exactly why the cloud is totally stepping up to that challenge. Now check out this staggering number, 78%. Customers are actually reporting a 78% reduction in data breach risks after making the switch to compliance cloud storage. Just think about that for a second. We're talking about wiping out nearly 4/5 of your breach risks simply by changing where and how your data is housed. It's wild. When tested against multiple HIPAA cloud solutions, the data consistently proves that dedicated cloud platforms offer a level of security that traditional on-premise systems literally cannot touch. It's a total paradigm shift in how we protect health information. Moving right along to theme 1, locking the doors. Let's look at how cloud storage acts as an impenetrable digital fortress. You know, data isn't just protected when it's sitting still. Look at this 3-layer encryption process. First, your data is encrypted before it ever even leaves your device. Second, it stays locked down during transmission across the internet. And third, it remains encrypted while it's resting on the servers. This continuous, end-to-end protection means that even in the absolute worst-case scenario, say the cloud servers themselves somehow get compromised, attackers are just left staring at completely unreadable code. There's zero raw data for them to actually steal. And the caliber of that encryption? That's what makes it so robust. Secure cloud storage platforms for healthcare like eShare.ai use AES-256 encryption. Why does that matter? Well, because it's the exact same standard used by the FBI to protect their classified documents. Under the HIPAA security rule, encryption is an addressable specification. Basically, you either do it or you'd better have a heavily documented equivalent. But in the real world, those alternatives rarely hold up if you're investigated by the Office for Civil Rights. AES-256 is the absolute gold standard you need to pass scrutiny. Building on that encryption is a concept called zero-knowledge architecture. Honestly, this is a complete game changer. It means the platform uses client-side encryption. Basically, the cloud provider themselves cannot access your files, even if they wanted to, or even if they were legally forced to try. They literally do not hold the keys to unlock their data. So this zero-knowledge setup is the absolute bedrock for maintaining unshakable patient trust. Your patient's data belongs to you and to them. Absolutely no one else. But beyond just locking out the hackers, you also have to manage who gets in from the inside, right? To do that efficiently, role-based access controls are a must. HIPAA has the strict minimum necessary standard, which mandates that you limit access strictly to what people explicitly need for their jobs. So a nurse only sees their patient list, an admin handles the billing records, and the doctor gets the full medical history. Cloud storage makes setting up this granular control totally effortless. Plus, if a staff member's credentials are ever compromised, boom, you instantly revoke their access with a single click. And the results of this role-based approach? Totally undeniable. When testing this kind of role-based system, it actually reduced unauthorized access attempts by 85% compared to traditional file servers. That is 85% fewer instances of someone, whether by accident or on purpose, poking around in sensitive medical files they have absolutely no business seeing. All right, let's shift our focus to the physical world with theme 2, surviving the worst. We really need to talk about the massive physical vulnerabilities of on-premise servers. A local server crash, a laptop getting swiped from a desk, maybe a burst pipe in the server room. These everyday disasters constantly threaten your patient records. And on top of that, relying on local servers creates this huge manual backup burden. Especially in smaller practices, somebody actually has to remember to run the backup, check the drives, and store them somewhere safe. Naturally, this manual grind frequently leads to missed updates, leaving gaping holes in patient data if a disaster actually strikes. To put that into perspective, it is absolutely critical to note that experts managing healthcare migrations found a crazy stat. 92% of on-premise failures actually stem from single hardware issues. Just one failing hard drive or a single fried motherboard can bring an entire clinic to a grinding halt. It's a massive everyday risk that moving to cloud storage completely eliminates. And here is exactly how the cloud eliminates it. Cloud providers automatically back up your data multiple times a day, and they don't just dump it on one server. They use geographically distributed servers. So, say a hurricane wipes out a data center in one state, your data is already safe and sound in another. By automatically handling these version snapshots across distributed servers, you can restore your data from pretty much any specific point in time. It completely lifts the burden of manual backup protocols right off your shoulders, all while seamlessly satisfying the data retention requirements mandated by HIPAA. Finally, let's dive into the regulatory side of things with Theme 3, the paper trail. Under HIPAA regulations, having an audit trail is strictly mandatory. You simply have to know who is touching the data. Comprehensive audit logs track exactly who accessed what file, the exact second they did it, the specific device they used, and what actions they took. When you look at logs from multiple HIPAA data storage providers, it's glaringly obvious that cloud platforms generate reports that are 10 times more detailed than old local servers. So when those regulatory audits inevitably happen, these meticulous logs give you instant, undeniable proof of your compliance. The real-world impact of those detailed logs? It's huge. Customers report that the agonizing 3 weeks of audit preparation they used to suffer through on local servers plummets to a breezy 3 days when using cloud platforms. That is literally weeks of administrative headache and stress handed right back to your team so they can focus on what actually matters: patient care. Now, there is a legally vital distinction you need to catch here. HIPAA requires a signed Business Associate Agreement, or BAA, with any vendor that handles protected health information. This document legally binds the vendor to HIPAA compliance and makes them liable for breaches. It is absolutely vital to remember that BAAs are automatically included in dedicated HIPAA-compliant cloud plans like eShare.ai. But, and this is a big but, they are not included in consumer services like Dropbox Personal or Google Drive Personal. You can't just use any random cloud storage. It absolutely must be a compliant platform willing to sign that BAA. As we wrap up this explainer, I want to leave you with one final thought regarding the future security and compliance of your medical practice. When you weigh the incredible advantages of FBI-level encryption, zero-knowledge architecture, automated distributed backups, and effortless audit trails against the very real physical and digital risks of on-premise hardware, can you truly afford to keep your patient records on local servers? The data and the regulations point clearly to the cloud. Thanks so much for learning with me today, and keep asking the right questions about your data security.